questions.
That was wonderful. So the reason we're talking about nurses coming here, why is, are there opportunities? Tell us. Are there opportunities for nurses?
I don't know how a nurse is paid in Kenya. Well, yeah. I think, if I'm not wrong, you guys can correct me because you could be doing better, right?
Yeah.
But I know they get paid maybe even some are 20,000, some are 30,000, some are 40, 50, to maybe 100, the highest maybe in big cities like Nairobi.
Okay.
Now, $100,000.
$1,000.
That's $1,000. That a nurse can make in a week.
In America?
Yes. So, and if you want to see, because somebody can say, hey, about the living standard,
cost of living, yeah.
Yeah, you know, still you're gonna make money as a nurse.
No matter what.
You're gonna make money.
So tell me, Zeph, what's the current pay? Can you tell my viewers or our viewers, how much can a nurse make here? Like a range, so, give us a range.
So generally, because every city is different, you can go to California, you're gonna get up to $70 an hour.
$70 an hour.
You other states would be average. I would say for a registered nurse is about $30 an hour.
Okay, so a registered nurse is you who went to MTC. Is a registered nurse.
Yes.
Right?
Yes.
Has a diploma.
A diploma,
MTC,
yes.
Yeah, has a diploma. So you're looking at $30 an hour to 70,
more,
75?
I would say, depending on where you live. Yeah. And now here is what makes a difference even.
Okay.
If you are travel nurse, then you're not gonna be like any regular nurse.
Oh, what is a travel nurse?
Travel nurse is a nurse that signs up a contract with who does contracting. You do contracts only.
Okay, so you're not employed by.
You are not employed by hospital, or you are employed by an agency to work with a certain hospital.
Okay.
And that is why then I'm in Arizona. I'm in Arizona for
on contract.
Yeah. My 3 months ends in Arizona. I came here from Texas.
Okay.
And I'm probably gonna move to another state. You know, travel around.
So how much? So what kind of money are you looking for? Are you looking at?
So
contract nursing. I know you said
right now for contracting nursing is about $4,000 in a week.
$4,000 in a week is.
I would say it's about, call it, okay, let's say.
Between, just give us a range,
I'm gonna tell you the list at the moment that is offered on the market is about.
Did you say $4,000 a week?
Yeah, so let's go. That's near the average. I would say the list. Let me talk about the list at the moment.
Hold on, let's post that.
I wanted to give you the minimum first. So the minimum, which can give us a good picture at the moment, is about $3,000 a week, and those
$3,000 a week, 300,000 Kenyan shillings a week.
Yes, and those are only working 3 days.
3 days. How many hours? 12 hours.
12.
So 36 hours a week. You make almost $500,000 Kenyan shillings. So that's why we're having this conversation, to tell you guys there's opportunities. Kujeni kama unaweza.
So yeah, so if you did that for a month, so the first week, if you are living extravagant, like we were having that conversation.
Let's not even go there.
So if you are living extravagant, your weekly pay, your first week can pay your rent and other things. Even though we're talking about that, you know, you get all those allowances for per diem, you know, if you are a travel nurse. But like I said earlier, it's so difficult to put all nurses
in one basket.
One basket, because it depends on your specialty. If you are emergency room nurse,
is that the one that pays more too, or?
Yeah, ED also pays more.
Okay.
ICU pays more. med surg more. Cardiac pays more. PCU pays more. PCU is a progressive care unit, where from ICU to PCU to med-surg.
Okay, okay.
So that is how it is. You can be also working in the one they call CCU, which is a critical cardiac care unit.
Okay.
Which is,
so they pay more too.
Yeah. So it depends on the specialty.
Okay.
You could be, maybe you like to do a laid-back job. You're still a nurse, but you're the one what they call home care nurse. Home care nurse is people who are discharged from the hospital. They decide to take assignment because this patient went home with a wound after surgery. You want to prevent any infection. So you visit this patient maybe once a week or twice a week to do the dressing change. And maybe went home with a PICC line. PICC line is like that IV PICC line that is central line. You're gonna go and help change the dressing for that and do the infusion. So that's more like a laid-back job. Some people prefer that, not everybody.
But they don't pay as much as...
It don't pay as much.
Okay.
So it depends on what you want to do. And if you really want a more laid-back that deals only with chronic illnesses, work in a nursing home. A nursing home, you only deal with these old patients who have what they call a long-time care. They have chronic problems, and that's all you do. They are not sick, they are there as home, but you help manage their medication and their care.
So do you think somebody watching me who is who probably graduated from MTC or is a nurse in Kenya, can they come and become a travel nurse right away?
No.
Why?
Zero.
Why?
Because you need to put down one experience.
How many years?
Because even if you have worked in a med-surg for 1 year, it's gonna, even if you went to school in US and work in med-surg for 1 year, it's gonna be challenging for you to get a travel job.
So you need how much experience?
They need usually need 2 years.
2 years of nursing.
Yeah, and
in the US, can the Kenyan experience count?
No.
Okay, so you have to come.
You're gonna freak out if they send you and you just came from Kenya and then put you on acute care.
Yeah.
And start as a travel.
It's too much.
What you gonna do?
I don't know.
Okay, you have knowledge, yes.
Yeah.
But you won't be able to handle that pressure in the first place.
Okay. So what's the best transition then from somebody watching and they wanna come here? So where do they start?
So when you just first arrive here, the reason first as to why they require like 2 years experience in the flow
is what?
Is because when you sign up a contract, maybe you decide to work in a big hospital, trauma hospital, they train you only for 1 day.
What?
Training is only 1 day. What? The second day you are on your own.
Wow.
At most 2 days. But so the first day, okay, the first day is training on the computer, so you don't see the patients.
So just knowing the system,
knowing the system, telling you, hey, these are the protocols, and it's gonna be really a busy, super crazy day. The second day is now when you are doing what we call a preceptorship. So you work with another nurse on the floor, showing you where to get stuff, how to access the pixies, doing this and this, doing this and this. And then the third day, you're on your own. You have your patients. And they don't say, oh, because it was your first day, then the care standard will be lower. No.
They still hold you to the same standard.
You are, yeah, they hold you to the same standard.
But do you have a supervisor, somebody you can call and ask? Or
one great thing with nursing is if you get stuck somewhere, you call for help.
And somebody
don't do things that you don't know, because you're going to kill somebody.
Yeah. But also you don't want to be like...
if you don't know anything, let's say, okay, the doctor has ordered medication that needs to be titrated. And these are very critical medication. Maybe people work in cardiac will understand. Maybe the doctor has just ordered medication that needs to be titrated with the blood pressure or with the heart rate. So the doctor will put orders, and then the orders will clarify, say, hey, titrate this medication every 5 milligrams, maybe in every, to achieve the heart rate of 80.
Okay.
So if the heart rate was maybe 150, so you keep monitoring using telemetry, monitoring the heart rate, and you keep titrating the medication.
Okay.
Yeah, so if the medication has been ordered and you don't know what to do, you need to know the limits of those medications, where you cannot go below or where you cannot above.
Okay.
And then, so what will happen is that you need to, if you don't know the medication, it's always a best practice to just say to somebody, hey, I've never given this medication. How do I do? Those kind of things.
Okay.
Yes.
So the best transition, first of all, you can be a travel nurse when you come. So what's the best, like, where can a person start when they're coming?
So when you just arrived here, I would encourage you to, if your goal is to go to that crazy high speed kind of where
the goal is to make money. How about that?
You want to travel, right?
Yeah.
So I would say start with med-surg.
Med-surg, okay.
Yeah, medical surgical unit. But if you really want to gain extensive experience, see if you can get ICU, which is so complicated. Nobody wants to hire you in ICU for training because they are tedious problem. Thing. You can do cardiac, because cardiac is more intense. You're gonna be dealing with cardiac drips, which are also a very high intensive medication, and that expands your knowledge. If you begin to travel and work in PCU or med-surg, you will fit so easy. You can handle any kind of pressure or anything.
Okay.
Yeah.
Okay.
And the reason why challenging is some of nursing is kind of different than Kenya is because nurses who work in med-surg, they manage so many medications. They manage heparin drips. They manage so many medications that are potentially very high risk medication that can kill the patient if they are not controlled well.
So thank you so much. So for someone who is watching in Kenya, where they are right now, so preparation of NCLEX, but if they have the opportunity, if they are working, what kind of exposure should they expose themselves that will make it easy for them here, easier? So what should they do? What areas?
If you are really nervous and you don't know what you're gonna do, start in a nursing home, because those are chronic, long-term patients.
No, so, no, I'm talking about someone in Kenya. What can they do now?
In Kenya?
Yeah, to expose themselves to what is going to be once they come here. So maybe work with cardiac. It sounds like you're saying cardiac.
Yeah, but I don't know, because I've never been to any cardiac unit in Kenya. I've never been to. I don't know what the nurses literally do on their own, like within their scope of practice, because here a doctor cannot order. You cannot find a doctor putting a PICC line himself. I mean, they do what they can do, but mostly they are done by nurses who are trained to do that.
Okay.
Right? So let's say IV. I'm not saying that the doctor cannot start it, but that is entirely nurse's responsibility. Okay. The doctor will only put an order that, hey, in any admission there are those automatic orders to start the IV, to do this and this and that and that and that. Okay. But let's say start a Foley, put a catheter on a patient. So the doctor will not come and do that. That's your responsibility. And the order is just there. You need to know what to do and how to do it. And the thing is, unless the patient really, but you need to do all those things, like when you insert a Foley and it doesn't go because maybe the patient has a, what we call a BPH, they call a prostatic hyperplasia, and like a benign prostatic hyperplasia. So then maybe you look for another one called a Coude, which is more stronger, can go through the prostate. If you can succeed, then you need to notify the doctor, and then the doctor, maybe the urologist will come and insert it himself.
Okay.
those are only exceptional situations. So I don't know the intensity of different units in Kenya, that can give you really equivalent to.
Yeah, or put you in
maybe,
a footing. Okay.
Yeah, maybe there are some places in Nairobi.
Okay. Okay.
I believe so, because I've never been there.
I guess we'll just leave it at that. Yeah.
Yes,
yeah,
but if there is when you come here, it's gonna be completely different.
So would you encourage somebody who just graduated from MTC to start studying for NCLEX and come over here?
That would be the most important thing, because even if you are to look for a place in Kenya to give you experience,
it's not
that experience will not help you. It's more than likely it will not help you here. Yes, I know you know how to do a blood transfusion, but every hospital in US is different even when you are doing a blood transfusion.
Okay.
Maybe the only thing that is common everywhere is that you check the blood pressure beginning, and stay with the
temperature,
and stay with the patient. No, check the vitals. The beginning, and
stay with the patient.
Stay with the patient 15 minutes, and check the vitals again 15 minutes into transfusion. Maybe that one is standardized.
So universal kind of.
It's kind of universal.
Okay.
But there are other things that every hospital requires. Documentation is different in every place.
Okay. So you heard it from the horse's mouth.